May the 28th, work session for the Board and Alderman. First item on the agenda is opportunity for citizen comments tonight on items that are not on the agenda. We have Mark King from the Williamson Medical Center here tonight, and he's backed up by Julie Miller, who we're always glad to see Julie, the COO for Williamson Medical, and appreciate all the great work y'all do out there. And so, Mark, come up and tell us what you got on your mind.
Thank you so much for having me tonight. My name's Mark King. I'm the Assistant Director for the EMS Department. And I don't know, I have some handouts here. I don't know how your process there. Okay.
We're better listeners than readers.
Absolutely. Well, maybe this will be something for you to read later on tonight. Anyway, I'm with the EMS department, and you've already introduced Ms. Miller, our Chief Operating Officer. Dr. Andy Russell may be joining us here in a little bit, our Chief Medical Officer, so I appreciate them being here with me tonight. I'm here to give you a brief overview of an exciting project that we've engaged in with the EMS department and also with the hospital, and we're glad to tell you about it, and hopefully it'll be something that you'll be as excited about as well. We're going to be bringing blood products to our patients in the field. This is an unusual and new venture for most primary 911 EMS departments. Actually, we'll be the first in the state of Tennessee to provide this to our patients, and the fourth in the nation. Currently, there are 2 departments in Texas and 1 in Virginia. So we'll be the only ones in Tennessee, and we're excited about that. Thought my phone was making noise, but it wasn't me. Okay. So we're in a unique position where we're located at geographically. By ground, we're about 18 minutes from Vanderbilt, the Level 1 Trauma Center in Nashville. And most of the time when we request an aircraft to take care of patients, we usually get a 25-minute ETA. Well, you can do the simple math. A lot of times it's better to take somebody by ground than it is by air. We currently cannot provide blood products, and I can do lots of neat treatments and provide lots of great care to our patients. But as Mayor Moore, or as I first knew him as Dr. Moore, will tell you, for a trauma patient, they need an operating room and a surgeon. And I cannot put the blood back in. I can control it, but this way we'll be able to provide that treatment to them and I think make a difference in a lot of people's lives. Currently, we have 35 critical care paramedics. We're excited about that because about 41% of our advanced staff are at that level of licensure. So it takes an expanded scope of practice and licensure for this to have been approved. We met with the State Clinical Issues Board and also the State EMS Board earlier this year and received unanimous approval. We were very excited about that. This will be a new thing for Tennessee, and we're hoping for great things from it. We got approval for a 1-year trial, and we're anticipating going live with this somewhere between the middle of June and July the 1st. We'll start our education of our staff in just about a week and a half now, which will be about an 8-hour day for the majority of our personnel. Some will be longer than others, depending on their practice within our organization. We're going to have a lot of oversight, as it well should be. With being a new program, we should have that. Our Williamson Medical Center lab, led by Patty Walton, will be in charge of that. Also, Dr. Jay Cooper, our medical director, and then of course the State EMS Board. We'll be carrying O positive and O negative packed red blood cells and also liquid plasma. We'll be able to provide that to our patients. We will not carry this on every ambulance. As you can imagine, there will not be a great need for this, but when these patients do need this particular treatment, this is what they need. So we'll have it in one of our 2 supervisory vehicles that we'll start off with the one that's based here in Franklin. And actually, it'll provide it anywhere that is needed, and so it can respond to the patient. So again, we're excited about this program. First in Tennessee, 4th in the nation. I think it's going to be a really great potential for our patients, and I just wanted to bring it to you and tell you about it. So hopefully, in case any of your constituents had any questions about that, you'd be prepared to answer those. And at this time, if you have any questions, I'll be glad to take those. Thank you very much. We're excited about it. Very excited about it. Yeah. All right.
Thank you.
Yeah.
Go ahead.
Thanks.
Absolutely. We'll be providing quarterly reports to the state. and we'll be glad to do that. Maybe after the first quarter or the second quarter, if that'd be okay. We'd be glad to come back and tell you about that.
That'd be great.
Thank you so much. Thank y'all.
Okay, now we have, to remember to push the button. And we're going to consider items 1, 2, 3 together as permits for Franklin on the 4th, Turkey Trot, and Franklin Classic. Any questions? We'll move on to item 4, presentation of results of the 2019 Franklin Citizen Survey.
So one of the things that we have incorporated the last few years, really this is the third survey of this kind that we've conducted of our citizens to really ask essentially the question, how are we doing? And get feedback in various ways, various forms of our service, elements of community, quality of life, and different components there. And so what we want to present to you tonight is the findings of the survey that was conducted the early part of 2019, share those results with you, give you some comparatives to especially how it relates to the survey we conducted in late 2016, and just sort of help you see the feedback we gained from citizens who both were randomly selected and those that chose to participate on their own directly in this survey instrument. So Michael Walters-Young has done a great job in helping shepherd this process through, and we're going to have him lead the presentation tonight in terms of what we heard from our citizens. So Michael.
Thank you, Eric. Good evening, Mr. Mayor, members of the board. Happy Memorial Day. Tonight we will review the methodology of the survey, the results, and most importantly, or as importantly, how it compares to what we've set forward in the strategic plan and the previous surveys this decade, as well as where we stand within our national and our custom benchmarks. All of these are available online. There are 7 individual reports that the National Research Center did for us with the results from the survey. They include sort of a summary of findings, which is the Community Livability Report, a dashboard summary of findings, which is a short sort of, here's a question, did it go up, did it go down? What are the trends over time? That's a new one, of course, because this is the second time we've used this particular survey instrument. And then we get sort of into the weeds. We look at demographic comparisons, the supplemental web results, and the always interesting report of open-ended questions, where we ask people to say exactly what they want to tell us about what's going on in the city of Franklin. So this survey was done in 2 ways: a scientifically valid survey of selected residents and an open-ended web-based survey. The scientifically valid survey was sent to 2,800 households who received various mailings beginning on February 5th of this year. They were sent a notification postcard announcing the survey. A second mailing contained a letter from both the mayor and the city manager inviting the household to participate, and then a questionnaire with a postage-paid returned envelope. A third and final mailing contained the reminder letter, another survey, and another returned envelope. Completed surveys were then returned and collected over the following 8 weeks. Of the valid survey, the scientifically valid survey, 4% were returned to because the housing unit was vacant or the Postal Service was unable to deliver. Of the remaining surveys, 792 completed the survey for an overall response rate of 29%. That is above the national average of 26%, but it's below the average of response we got in 2016 of 36%. That being said, we also opened the survey up for 3 weeks on March 12th to all comers to fill out on the city's website. 1,598 surveys were received, so if you combine the two, you had over 2,300 surveys returned, which was nearly double the combined total that we had in 2016. The results which I will present herein are on the scientifically valid survey, or those 792 which were received. One note, the data isn't that different if you look at the open-ended web-based survey for all comers and the scientifically valid survey. There is more information because there were more surveys filled out. And you'll note that the percentages are slightly different, usually 1% to 2% lower on the all-comers survey than on the scientifically valid mail-based survey, but not statistically significantly different. So there's a methodology that the National Research Center uses to do the citizen survey, and it's designed to measure the livability of a community, or the sum of factors that add up to make a community's quality of life. They have found that there are 8 facets of community livability. They include safety, mobility, natural environment, built environment, the economy, recreation and wellness, education and enrichment, and community engagement. Should note that it was under education and enrichment that the survey responses were so good last time that we received the 2017 Voice of the People Award for having the best community in America for education and enrichment opportunities. There are also 3 individual items or pillars that the data they've been able to compile shows that measure the livability of a community. And those break down into community characteristics, the inherent or acquired amenities, such as the design of the community, governance, the services that are provided in local government by Eric and myself and all of the staff behind us, and the level of trust that residents have in all of you, and participation, the ability to connect with fellow neighbors, use community amenities and services, attend worship services, or what researchers would of course refer to as social capital. So how are we doing? Overall, the results are really, really positive. In fact, they're as good as they were, if not a little bit better from the data than they were 2.5 years ago. In terms of quality of life, 97% of respondents rated the quality of life in Franklin as excellent or good. The ratings have actually improved since 2016, although it was still 97% 2.5 years ago. 68% now rate the overall quality of life of Franklin as excellent. 63% rated the overall quality of life as excellent 2.5 years ago. Compared to the national benchmarks and the other 600 cities that take this survey, we rank 3rd in the nation for overall quality of life. The chart behind me shows the 8 facets of community I spoke about a minute ago. And of those 8 facets, safety, mobility, and economy were the 3 facets that members of the citizens who responded to the survey rated as most important to them. Safety, economy, recreation, wellness, education, enrichment, and community engagement all had much higher ratings overall compared to other cities and towns that responded to the survey nationally. So, taking a look at those 3 pillars I mentioned, the first one is community characteristics. 99% of residents rate Franklin as an excellent or a good place to live. The ratings are much higher than quality of life ratings in other communities and higher than they were in Franklin in 2016. And compared to national benchmarks, Franklin ranks 6th in the nation as a place to live and 1st in the nation for overall image and reputation. If you can't be proud of that, I can't help you. That's something that we felt really good about, and all of you should feel good about too. That the citizens who choose to live here and who want to live here do have deep pride in Franklin and view us, view themselves with very, very good reputation. And there are small breakout bars as well, 96% excellent or good in overall image. They rank their neighborhoods, 94% as excellent or good, 97% good as a place to raise a child, 84% as a place to retire, and 96% in overall appearance. The second pillar of governance indicates that 93% of residents rate the overall quality of city services as excellent or good. This is similar to where it was in 2016, but just like overall scores in other areas, the amount of people rating city services as excellent increased. Franklin ranks 11th in the nation for overall confidence in city government and 6th in services provided compared to other cities and jurisdictions. Both of those numbers have gone up since 2016. You can see as well smaller bars on the chart behind me. that, we rank pretty much between 74 and 78% in being honest, acting in the best interests of Franklin, confidence in city government, welcoming citizen involvement, overall direction of the city, value of services for taxes paid, and treating all residents fairly. One area where we as staff take tremendous pride is that 91% of respondents rate customer service as excellent or good. And 53%, because this is a standard questionnaire that's asked in 600 cities across the nation, rated services provided by the federal government as excellent or good. That is up 9% in the city of Franklin from 2016. FYI. The final pillar is participation. And that indicates that 83% of citizens feel that the sense of community is either excellent or good. 96% of respondents would recommend Franklin to their family or friends. 91% would choose to remain in Franklin. And 37% contacted Franklin employees. The rest of the indicators that are mentioned on this slide really didn't move that much. 88% of residents indicated they had not reported a crime. That was up 1%. 94% had not been the victim of a crime. That's down 1% compared to 2.5 years ago. Less than 1% said that they'd used public transportation, and 4 in 10 reported that they had walked or biked instead of driving. That's unchanged. 7 in 10 residents indicated they had participated in the natural or built environment. That would mean that they're getting out, walking around, enjoying the parks and trail systems, etc. And 2/3 had said that they had participated either in a city-sponsored event or in a religious or spiritual activity. Both of those are higher than national benchmarks. We also then ask 3 questions specifically tailored to the city of Franklin. And one of these is arguably one of the most important questions we ask, which is, rate your level of satisfaction with the city of Franklin's management of growth. We ask this question because it's a concern, obviously, we all have, but also because it's part of your strategic plan. 80% rated their satisfaction with the city's management of growth as either very or somewhat satisfied. Now, the good news is that is the target level that we have in the strategic plan. We want 80% level of satisfaction with how we manage growth. I will say that in 2016, that number was 84%. It's also important to point out that although this is a positive response and we're meeting our targets, it's clearly on citizens' minds. When we look at the open-ended responses, 1 out of every 4, almost, or 38% of all open-ended responses had to do with some facet of growth, concern of growth, cities growing too fast, or it's getting too crowded. It's also worth noting that the minority of those who said they were very unsatisfied of growth went from just 1% were very unsatisfied 2.5 years ago to 7%. Now, 4 out of every 5 people are still satisfied with the management of growth. I don't think it comes as a surprise to any of us sitting in this room, however, that growth is a concern of the citizens of the city of Franklin. Certainly, sitting here as we do in our meetings, you hear that almost, well, every meeting. The second question we asked, which was non-standard, was asked to determine what methods citizens prefer to communicate with the city when they choose to do so. And I have to say, we were a little surprised by this. We asked them email, phone, in-person, snail mail, Facebook, Nextdoor, Instagram, or Twitter. By far, people prefer to contact the city via email, and then via phone, and then in person. Social media contacts actually were significantly decreasing as you went down the list, with only 16% of respondents likely to try to contact the city via Twitter, 18% via Instagram, and 25% via Nextdoor, and 32%, or less than 1 in 3, via Facebook. You can't read any more into it than that, whether or not that's, how we choose to communicate. But it's still clear that people like to receive a written answer and like to be able to actually talk to someone at the other end of the phone, which we also feel is good because, again, our overall ratings of customer service are 91%. Final question we asked was the open-ended question. Residents were asked to state the most important challenge facing Franklin today, aside from traffic and transportation. That's how we have phrased this the last 2 times. 2/3 of respondents said that growth, development, losing community feel, housing, affordability and availability, and transportation were the top 3 issues that were of concern for them. Again, to emphasize how concerned, or at least the intensity of concern on growth, 38% responded growth, development, losing community feel, compared to just 19%, or 2 to 1, regarding affordability and availability of housing. Comparing to where we were in 2012 and 2016, we've tried to select a few sample questions and a few sample areas that were comparable between all 3 surveys. The first was, are things in the city of Franklin moving in the right direction? In 2012, 82% said yes. In 2016, that number had dropped to 73%. And in 2019, that number had increased to 3 out of every 4, 75%. Overall quality of life in the city has held steady at 97% in the last 2 surveys, which is a 3% increase from where it was in 2012. And again, something that we take great pride in is that the job of being done by city government has steadily increased from 83% positive in 2012 to 89% positive in 2016 to 93% positive in this year's survey. The things we do really well, or the opportunities that they have gotten better. The feeling of neighborliness, in terms of feeling that it's excellent, has gone from 20% in 2012 to 27% in 2016 to 32% in 2019. Economic opportunity has doubled with each survey, from 8% excellent in 2012 to 19% excellent in 2016 to 37% excellent in 2019. And I will tell you, when you look at the economic questions that were asked, we rank, with the exception of cost of living, in the top 10 or top 3 in every category nationally compared to the rest of the survey respondents on issues of economy. And people like their shopping opportunities in Franklin. 8% rated excellent in 2012, 50% excellent in 2016, and it's only gotten better. 58% of survey respondents like to shop and like the quality of their shopping here. Could be Apple. I will leave that up to all of you and your choice of shops. The things that we weren't doing well, though, or that they rated poor, some have gotten worse, some have gotten better. Cost of living has held steady at 20%, rating it as poor. Affordable housing has gotten worse. 11% rated the affordability of housing as bad in 2012. That jumped to 35% in 2016. Now over 4 out of every 10 rated as poor in 2019. Interestingly enough, the ease of getting around Franklin and traffic and transportation has gotten better. The perception. Perception is key. 16% rated as poor in 2012, 29% rated as poor in 2016, and now only 23% rate the perception of traffic and transportation and the ease of getting around as poor in 2019. Finally, a level of diversity within the community is 8% poor to 9% poor to 10% poor. We also take a second to look at the value of services for taxes paid. That has held steady from 2016 to 2019, but again, as we've seen in some of these responses, those that rate the excellent versus good has shifted. They're not apples to apples in this question if you look at the 2012 survey to 2016 and 2019. The fact that 24% rate the value of services to taxes paid as fair or poor 2.5 years ago into today is, again, something we feel good about. Keeping in mind, of course, that when the survey was taken the last time, the Invest Franklin initiative had not hit their tax bills yet. So this is before the tax increase from 2.5 years ago, and this is the first survey we took after that decision. Brief slide showing the comparables. Not a lot of change regarding the age of respondents and the years lived in Franklin response. I will note in 2016, 36% had lived here 0 to 5 years. That number is now up to 41%. Most of the other indicators have remained steady in terms of rent-to-own ratios and who's responding in terms of gender. We will start to wrap this up looking at the comparables. This is just a simple chart that we look at two sets of comparables, how we rank nationally compared to all 600 survey respondents, and then within our particular segment of the population, 50,000 to 100,000. Another chart that should make you smile is the fact that in the following categories, we rank in the top 3 nationally. Overall quality of life, overall image or reputation, Franklin as a place to raise a child, overall economic health, the vibrancy of our downtown and commercial area, the overall quality of our businesses and service establishments, employment opportunities, Franklin is a place to work, the opportunities to participate in religious or spiritual events and activities, and economic development. We're also much lower in some categories. Those include the availability of affordable quality housing, the ease of ability to travel by bicycle. Prepping apparently is something that we don't do as much of in Franklin as some cities. We rank 168th nationally in residents who stock supplies in preparation for an emergency. That may be because they feel confident that we'll be able to respond in an emergency, but nonetheless. We rank 159th for residents who use bus, rail, subway, or other public transportation, 200th as people that chose to walk or bike instead of driving. We're also not terribly good at conserving, 217th in national rank of those who stated that they made an effort to conserve water.
This is definitely not 2007, because if you remember,
Different time, yeah.
Yeah.
different
Major,
time.
Shortages.
Finally, if you look at just the lens of our demographic group, 50 to 80,000 people, 50 to 100,000 people, we rank first in the nation in the following categories: overall quality of life, image and reputation, place to live, place to raise a child, appearance, public places where people want to spend time, economic health, vibrancy of downtown, employment opportunities, place to visit, place to work, opportunity to participate in religious or spiritual events, opportunities to participate in social events, neighborliness, opportunities to participate in community matters, value of services for the taxes paid, economic development, and city-sponsored special events.
Is that nationwide?
That's for our size of city. So city is 50,000 to 80,000.
Nationwide?
Yeah, who took the survey? Yes, ma'am.
Yeah.
Yeah.
This looks different from what we got.
Continue, Ms. Ann.
Oh, continue, thank
Yeah.
you. And where was this in the thing? I remember seeing it, but I don't remember which one of those.
Get your, turn your mic on.
Oh, I'm sorry. Where was this in those, like, 8 things? You know, I mean, was it in the crosstab or the, things like that,
This would have
technical
been in the technical
appendices?
appendices.
Okay, okay, good, thanks. I saw that, but I didn't know where it was.
So next steps with this data. We've met with staff and leadership team. We've integrated the findings into the 2020 budget. The website is available with all these materials. We'll add this presentation after we're done here tonight. And this next step is to present to you. We will integrate the findings into our strategic plan website. And we certainly encourage citizens and all of you to read these comments, especially the open-ended comments, carefully. I would say from my research and analytical mind, this is a very good survey. You should be very proud and feel good with the citizen responses. But you should also read the open-ended responses. Growth is a major concern. And that's why we do this, though, and we do it regularly, is to ensure that we try to keep a pulse from a statistical mind on what's going on within our community.
So when you look at it, we do this as a way to track perceptions. Also within the budget and then the strategic plan, there's 65 plus different measures, many of which are more related to service delivery and things that we can count and measure directly. And I think when you blend those together, that's when we try to get a good picture of where we are and how we're doing. And I would agree with what Michael assessed. It's very positive, it's encouraging, but when you read those open-ended comments, there is an increase in the intensity of concern from citizens from 2.5 years ago and even further back to late 2012. And it was a different survey instrument then, but still, the fact that that is there and it's regular, and we ask them, and I would say the assessment I would give you is people really love this community. They're proud of it. They love living here. They appreciate the quality of life. But they are also concerned that the magnitude of growth, the intensity and pace of growth could harm that quality they love so much. And I think that tells us, really, that's a very important message. I think it's a message that we have tried to hone in on with a lot of the work we do with capital projects and the long-term planning that we've tried to do, and many facets of what we do focused on quality of life and how we support the need for services of a growing community and one of the fastest growing communities in the United States. So I think it is encouraging, but it is also well worth our time to look through and ponder and think about those open-ended responses, because that's what's on the top of mind for a lot of our citizens. And I think it supports the type of long-term thinking and investment that we're trying to stay focused on too. So.
Alderman Peterson.
I've already had a citizen say to me, all the aldermen ought to read all of the open-end comments. And it'll take a while, but it's very, and I agree, growth was the biggest concern, but I did see an uptick in concern about crime, and, some other things like that, too, that were a little surprising to me. But as I say, there's some really strong opinions put out in the open-ended, and they probably do need to be read as we move along.
Alderman Martin.
I've also had comments from citizens about the survey. It is very good. It's encouraging to know that we are where we are. It's really amazing. I mean, it really is a miracle that we are where we are from where we've come. However, on page 19, when you talked about the where we rated poorly, if you see from 2012 to 2019 how we have changed, all of that relates to growth. 8% level of diversity in 2012, gone to 10%, 11% affordable housing, cost of living 15% to 20%. All of this, where we've gone down, has to do with the growth. It was suggested that maybe it would be a good thing if the aldermen could have a mini retreat to just talk about this, to talk about those areas where there was deep concern, like the growth, the traffic, the parking, and we don't want to fall behind. And I know we are addressing a lot of this in what we've already done, what we are doing now, and our future plans. But I think it would be good for us to just get together and talk about it, because we don't really have time here to talk about it. We don't talk to each other here. We address what's in front of us. So we don't really talk. And we need some time to do that, to talk about how we can address these issues and these concerns. I guess there are ways to deal with it. I just don't know what they are, and we're not really addressing them that I know of, other than through our land use plan and our Envision Franklin. But when things come before us, like they did in April, about infrastructure. We didn't have the infrastructure to do certain things. All right, what are we going to do about the infrastructure? Well, maybe we ought to say no to certain developments when they come up. I mean, we don't have to build everything to suit everything everybody wants to do. And if growth is an issue, then maybe we need to address it. And so I would suggest that we think about that, having a time where the aldermen could get together and discuss ways that we can address people's concerns.
Alderman Martin, I think that you've been very eloquent in your comments, and I think that is, you've raised a good opportunity for the board to come together and understand better the challenges we face as a community because of the growth that we've experienced. And I've been asked a lot of times, what are you doing about it? And I think you mentioned a few things. You mentioned the land use plan, Envision Franklin. Certainly our long-range transportation plan that's linked to land use comes to mind. Our integrated water plan, which looks out 20 to 25 years. Our financial planning, which is looking long-term. And then just how we're doing our capital projects. I'm not, maybe other cities are doing this, but I don't know anybody that's quite doing it like we are, where we're looking out 10 years and funding them. But I think that you raise a great opportunity for us to come together as a board and look at what kind of policies or plans or whatever we need to do for the future. I think it'll be interesting to see what in 2 years, what the study results are as far as housing, because we're making some progress on housing now. I'm encouraged by some of the things that are happening. But, clearly growth, transportation, housing, are always things that, that I mentioned and people ask me about. And now we're having to add workforce on that because we're being challenged. I always thought that we'd have more jobs than we had people by 2040. It's happening much sooner than that. So I think there's a lot of policy areas we could have some great discussions about, and I look forward to, if you'll let me be at the meeting too.
I wish you would call the meeting.
I plan on calling the meeting at your suggestion, and I'll work with Eric and staff to find us a time and that's convenient to everybody, and we'll figure that out.
We did that about maybe 18 years ago. We went to one of the state parks. They had an all-you-can-eat seafood buffet. I'll go for that.
We're going to take that suggestion under consideration also.
I'll take menu suggestions.
Any other comments? Any other comments?
I just want to thank you, Michael, for this. This is great.
And I appreciate the board's support in doing this. It's not always easy to ask the question, how are we doing? You have to be willing to ask it and listen to the response. And that's what we've tried to do and try to reflect it in the budget. And I think we continue to work through that. But I want to thank you for your support in doing this. I think it's very helpful for us because we can measure certain things, but asking people their perceptions in this way gives us a more greater depth to the whole process. So thank you for supporting it, and thank you, Michael.
Does the board have any shellfish allergies? Okay, just clarifying. Okay, I guess we're ready to move on with the presentation of attainable housing. I guess we're ready to move on with item 5, presentation of attainable housing update.
This is, it just seems like we had a good setup from the last part to this one. This is a fairly focused report in terms of specific aid that the city has been able to provide to help in the development of attainable housing, primarily focused with our use of CDBG funds. And Tom and Kathleen are here to kind of walk through those specific projects and impacts over the last year or so. So take it away.
Thank you for having us here tonight, and I'll be as brief as possible and answer any questions you have. As you know, we, the City of Franklin, and yourselves have been working towards attainable housing for many years. And briefly, I just wanted to mention since 7/1/2018, with your support, the Village at West Main has been completed, and each and every one of the units are sold and it's fully occupied. Additionally, we have done another single-family home on Natchez Street, which was sold to a Franklin businessman and his wife, which was really wonderful. And we have now finished out Bungalow Court at Hard Bargain. Each one of those homes are finished and resided by families or individual, single families, single moms with their children. And so in total, we have about 33 units that have been completed since 7/1/2018. In progress is which will be coming before you again, the Chickasaw project, which will be the 48 multi-family rental units, which will be monitored by the Franklin Housing Authority. Additionally, Hard Bargain will be filling a corner lot on 11th Street with another single-family home. And Rucker Avenue, which the Housing Commission, we worked hard to identify vacant land within the city of Franklin, and this was one that was identified. And CHP has moved forward with purchasing that lot, and that too will house, that one's actually going to house a 3-bedroom, 2-bath home, and that will be completed probably before the end of this year. And it will be sold at an affordable rate and deed restricted for 20 years. And as far as the status goes, the CBDO, we have for fiscal year 2019, we have $127,344 left, but you will have 2 contracts coming before you to support those 2 homes we just discussed. The public facilities was allocated to Franklin Housing Authority to assist with the Chickasaw project. Emergency repair, we're working on that because we do have the programs are limited to age and restrictions, but we are actively working those. Admin, that goes right back to the city. So the city always gets 20% of whatever the grant total is, goes back to the city. And we have fair housing education outreach, which we are actively pursuing. And as far as, sorry, lost my place. You'll see the next one shows just a rough rendering of the home that is going to be on Rucker Avenue, which, like I said, I'm pretty excited about that. And that was the final home on Bungalow Court, which was sold to the twin sisters, and the under construction Chickasaw Senior Project that is coming soon. And next year, we are very gratified to know that we will be receiving $353,910, which is an increase of approximately $40,000. So you all must be doing a great job. So thank you. Any questions?
Alderman Bland.
Chickasaw Senior, but in one of the slides it said multifamily, so I was confused.
My understanding is it's going to be senior and multifamily.
It's multifamily dwelling units, age restricted for senior adults.
So it's both? Got it,
Yes.
thank you. Just clarifying, I keep calling it a senior residence, and so when you said multifamily, I went, oh, was I wrong? So,
Alderman Bransford.
I know there's money still in the slot for emergency repairs, and you mentioned there are certain criteria to that. It must be owner occupied.
Owner occupied,
and a
55.
Age limit, okay. So it's hard to find those.
We're
Those-
moving forward with trying to get the word out again.
Yeah.
When we were more actively pursuing that, I was having better luck.
Yeah.
And unfortunately, right now, we're in a boom time and trying to find contractors that are willing to take on such a small
Yeah,
job.
yeah.
But we're working it.
Just want to make sure we said this publicly, so if anyone listening tonight, that they have a grandmom or aunt or someone that's in a home, and then the bathroom floor need to be fixed, or the kitchen sink is leaking or whatever, we need to make sure that we get that, they know that they can come here and request some aid.
Absolutely.
Yeah.
That program is
Yeah.
specifically tailored to keep seniors in
In
their
the home,
homes and
yeah.
deal with those kind of repairs. So and it's helped many, many folks with that, and we would encourage you all to get that word out as
Yeah.
you see that need.
Alderman Martin.
The picture of the Chickasaw Senior Community on page 7 of that right there. Surely that's just the rendering that
Yes.
shows those windows on the ground.
In the ground.
No, very much. That's just their rendering. Yeah,
It was
that's,
just a
it
rendering.
was part of their artist concept that they submitted a while back. So that's not the detailed architectural sketch that came with their
That's a
site
good
plan.
thing to know. Okay,
And
thank
I
you.
think if you comparable to the Reddick project in terms
Yes.
of look and feel. So if you're pleased with that outcome, I would expect you'd like Chickasaw as well.
I just wanted you to have a
Say.
picture to fill in.
I do want to say, what they did on Reddick was really great. And, you know, inside and outside looked like it really fit what it was designed for, and I was very pleased.
And actually, as requested previously from the Housing Authority, they are coming, I think we have it scheduled now for your second work session in June. Well, they will provide you an update on their entire program, the things they've completed and the things they've got going forward. So I bet their architect will bring better pictures for you.
Please.
Okay, I guess we're ready to move on. We'll go to item 6, which is a contract with the Hard Bargain Association for receipt of, how timely, of community development block grant funds from the city of Franklin as reimbursement for costs associated with construction of a single-family home. This is the one you referred to. May we move on? Item number 7 is a resolution of the city of Franklin relating to the establishment of a self-insured workman's compensation program with claims administration by a third-party administrator.
Items 7 and 8 really go together. Item 7 is the resolution guiding us or approving us to move into a self-insured program for workers' comp. And item 8 is the award to the third-party administrator who will provide support for that self-insured workers' compensation program. We had presented at the end of May an overview of our proposed approach. We had not received specific numbers from that third-party administrator. Those have come in, and so that allows us to give you a more complete picture. But we are recommending moving forward in that direction. So I'll let Kevin and Sarah and Laura take it away from there.
Okay. And yes, I'm Kevin, and I'm going to have them introduce themselves.
I'm Sarah Silvis, the Risk and Benefits Manager.
I'm Laura Young-Michael, and I'm your insurance broker.
So I brought my dream team up here to talk to you about this. And as Eric says, we explained to you last time, we reminded you on what the city has done in the past, take care of workers' compensation. And now we're at the point where we do have a recommendation that we are self-insured. To get there, for the purposes of this today, we thought it was important to look at what would it look at if we were self-insured and going backwards with our worst year. Our worst year would have been 2017. So we look at this in 2 ways. One, what would the cost be on our worst year? And also, when we quoted, we had our RFP to find a third-party administrator, a TPA, we looked at what would be the average. What's the average claim loss we have? So, based on the average, we estimated that 85% of the claims would be medical only. 15% of those claims to be indemnity claims, those that end up in lost time. So if you look at what we spent this year on an average, this would be considered an average year, the administrative fee under our current carrier is approximately $44,000. There is no system fee, and the system we're talking about is their I would say HRS system. It's their online system to report medical problems. There is no cost currently. If we went to a third-party administrator, like the one we identified, the administrative fee would only be $4,000 for this year, would have been $4,000 this year. And to use their online system, that would be $6,000 for 5 users. So we're talking about the annual cost to use a TPA under our fixed fee, our flat fee, would have been around $10,000. and currently it costs us approximately $44,000 just to be in their large deductible program. So now if we look over at the loss-dependent fees, these are the fees that change, vary upon what sort of accidents we have. Under our worst year, the claims administration would cost us approximately $44,000, and the managed care cost would have been $128,000, for an annual total of $173,000 to administer the workers' comp. Had we been self-insured, those fees would have been $89,000 on our worst year, as opposed to $173,000. The reason that, and so as Eric says, it's tough to have a discussion about why we would go to a self-insured model without talking about the third-party administrator. It's tough to do. You can't do it without that. So let's talk about the third-party administrator we identified. It's PMA, Pennsylvania Manufacturing Alliance. We're suggesting that you allow us to choose them because, one, it's been crystal clear that we don't want our injured employees to have to suffer from poor service now that we're no longer fully insured. So we have to get an entity that has lower claim, that's used to managing fewer claims. Each representative that's assigned to us manages fewer claims, so that with fewer claims, you get better customer service. So the examples we have would be for our third-party administrator, PMA. Currently, our current provider, those representatives would handle over 200 medical-only claims. If we were to go with PMA, they only allow them to have about 110 medical-only claims. Currently, our current carrier, their load for lost time claims is approximately 145. Under PMA, their average is they keep them to 106 claims. So again, we're talking about better service because they have fewer claims per person. Now, realize this is not anything negative about our current provider. They've been excellent for us, and we would say that they would continue to have our other lines, meaning they'd still provide us insurance for police, crime, Arizona Mission, property, pension, those sorts of things. All right, so another reason we're suggesting that we go to PMA is their pharmacy network is the same as our medical insurance carrier. Same network as our medical insurance carrier. And also, I touched on it earlier that they have a system, it's called Cinch. It costs about $6,000 for us to use. It's more effective because it's online. It's better OSHA reporting capabilities, which will save the staff a lot of time if we can do it online. Also, the PMA entity interfaces with Kronos, which is our HRS system. That's a huge time saver, and it makes things more accurate in terms of getting demographics such as someone's wages and their social security numbers and such. So this is all possible, again, only because we have a great claims history. Sarah's risk management team does an excellent job educating our employees. The programs we have in place have provided very small injuries, very small accidents for our employees. For an entity our size, it has employees that do the dangerous things that some of our employees do. So again, let me hit a couple more points on the PMA. Their physician network is also the same as our current carrier, so there will be no change there. PMA has over 300 public entity clients. That's important. They are used to dealing with entities like ourselves. They have an office in Nashville, Tennessee. Their client retention rate is over 99%. Also, PMA is providing a designated team to handle our claims management. And so that's why we say that using a TPA is going to help us transition. So let's talk about what's another big thing that's going to change. Currently, we're in a large deductible insurance model. That requires we post a cash collateral. We have to post a cash collateral it leaves the city of Franklin and goes to an entity so they can draw from it to take care of bills. That's not small money. We're not talking about small dollars here. We're talking about it can average anywhere from $250,000 to $550,000. That's money that's not in the city of Franklin's coffers. We're not deriving interest from that. That we don't have to have if we have if we go to a self-insured model. So of course, we're allowed to draw interest on that money that is retained here at the City of Franklin. So for those reasons, we're suggesting that, one, it makes sense to go to a self-insured model. Two, it makes sense to use the third-party adjuster that we have identified, PMA. So the next steps, and the next steps would be, one, you give us that permission to do so. Then we'd have to file a self-insured application with the Tennessee Department of Commerce, and then we'd have to obtain a $500,000 surety bond to comply with Tennessee Code Annotated, and the cost of that would be approximately $10,000. So that's the presentation. That's why we think it makes sense, and we're here to answer any questions. By the way, please tell me if I left anything out here.
You did great.
Okay.
Alderman McClendon.
If we do this, what's the worst thing that could happen?
Well, and I'll let you jump in. We would still have insurance at an attachment point so that we wouldn't be on the hook for something catastrophic. We'd have insurance for that. I'm suggesting that the worst possible, well,
Was 2017 an outlier, or was there one thing that happened that like really pushed it over the edge, or?
how would you address that?
That particular year, you had more lost time claims where it wasn't just a medical only situation. For whatever reason, it was a spike. All of the other 6 years in those 7-year period that we were looking at have been really excellent and have had a very low percentage of indemnity. In that period of time, those 7 years, you have right now with the current carrier, you're on a large deductible program, which is almost identical to being a self-insured entity. And in those 7 years, you only had 3 claims that went over the stop loss for a per claim limit, which means you only would pay up to $100,000. Anything over that would go.
And we'll
would be
maintain that
paid.
reinsurance or attachment point or whatever you want to call it?
Something similar to that, yes.
Okay. So do we need additional personnel to do this?
No, that's why we have the third-party administrator. They're going to administer this program.
Okay. Thank you.
Alderman Speedy.
My one question would be, I guess it would benefit us even more if the workers' comp claims continue to go down, and we're assuming some of that may happen with some of the automation of our sanitation services that we're rolling out. And then my last question would be, I know nationwide, like disability claims are down when we're in a very strong economy, low unemployment. Is that similar with workers' comp or not quite as close correlated?
I'll give my thoughts. One, you're correct. It'd have to be significant in terms of what we're doing in sanitation because the amount of money that we need to put aside, it does grow with the larger the workforce is. So if our other parts of the workforce grows, then I can't say that. But yes, if nothing else grew and we decrease sanitation, you're correct. In terms of, well, I'll let you answer the question about the industry.
Well, just from an industry as a whole here in Tennessee, we've benefited from the Work Comp Reform Act of 2013, which the legislature passed and went into effect July 1st of 2014. We went from a court-based system to an administrative law judge through the Department of Labor. And so now Alabama is the only state in the union that has a court-based system. So instead of having 95 county judges administering work comp claims, now it all goes through the administrative law judges through the Department of Labor. So we've seen as a whole all of the judgments basically come down. It used to be you could potentially get up to 6 times an impairment rating, which could be many hundreds of thousands of dollars. So it's not now much more on an equitable basis where everybody's kind of being treated the same for the same type of injury. Still, you get a rating, and you can get a percentage of that if you've got a permanent injury, like a finger, 4%, something like that. So as a whole, you're absolutely right. Work comp has continued to improve. And the other side of that law was that it was to ensure that injured employees are getting the best medical care possible. And they extended the number of weeks from 400 to 450.
And the sanitation change in terms of recycling, one of the major considerations for us was the worker safety component. There's a lot of elements there that can lead to injury, and by automating that, we will lessen that risk. And one of the things Sarah and her team does, we have staff that focuses on training and on how we find ways to prevent accidents. And so they study the nature of claims and things we have and look at ways we can better equip our people or train our people to avoid accidents in the future. So we're very cognizant of that. All that will continue, and we'll hopefully get the direct result and direct benefit from doing that kind of work.
Alderman Martin.
Sarah, I guess you maybe are responsible for this along with some of our other department heads, but I noticed the other day we had city employees checking sidewalks for broken concrete and the concrete that's been uplifted by tree roots. But I guess that's what was happening, because there were 4 men checking sidewalks, and I'm assuming that's what it was. So that's a great thing. We need to do that. Our sidewalks in town are old, and this was in a new section, but even new sections can have humps that can cause problems. So thank you for doing that.
Yes, so we regularly do inspections like that, but especially when there's an event downtown, we do a regular walkthrough to make sure the space is ready for that event. So that's one of the things we do.
And as soon as we get any kind of notice on something like that, we try to respond to that immediately in terms of getting somebody out there to look at it and take any corrective action that we can.
Well, a lot of that's been done in the last few weeks, and I thank you for that, and especially in Ward 4.
Okay, we're ready to move on to item 9. It's consideration resolution 2019-54, establishing the city's contribution to health care coverage for retirees electing option 2 coverage.
So one of the things we have done for the last several years, One of the things we've done for the last several years is provided, and this has been a long-term benefit to employees that retire but are not yet eligible for Medicare. And so there's sort of a bridge coverage. It is our old option 2, which is now no longer available to our employees, but we've preserved for this retiree group. And back in around 2011, 2012, we set a flat amount that the city would contribute to that retiree insurance. And that has not changed in those 6-7 years since then. As we reviewed that, obviously costs have increased, and so that is a lesser share of that cost of insurance. And we looked at it and also looked at the way we handle our employee insurance, where we've set by policy sort of a percentage share that the city will pay. And so in this case, we are proposing that we take a similar action in setting a standardized percentage that we contribute to retiree health insurance for that group that is, retired but short of Medicare eligibility. And we would recommend that we set that at 40% for all of those retirees, regardless of whether it's family, single plus child, single plus spouse, or single coverage, that we'd approach that all the same way. And so that's the proposal we're bringing forward, and I would like your direction to implement that. This will provide more coverage, more city contribution than folks receive today in all those coverage categories, with the exception of employee plus child. It's in the same category. It's just slightly less given the percentage calculation. But we think this will provide a little better support for that health coverage for retirees, and then also provide a standard going forward so that that percentage doesn't slip away from us as costs escalate in the future. And we feel this is a manageable component for us to just plan around going forward.
Alderman Barnhill.
What percentage is it now? I assume that in 2011, we probably were looking at maybe 40% then?
It was in that range, yeah. It's $250 for single coverage, and it's $500 for everything else. 200, I'm sorry, but that, 200 for single and
Single.
500 for everything else.
Everything else?
Yeah.
Okay.
So I don't have the exact number, what that was in 2011. I don't know if either of you have that. But that it was probably in that category. I'd have to go back and look at the exact numbers, but it was probably close to that 40% then, and that is sort of eroded over time.
So we're looking at an employee, at us, at the city paying no more than 40% of the 200 or the 500.
Well, it's actually 40% of the premium,
Right.
which for fiscal year 20, which is beginning here shortly in July, that $200 for the single coverage, the city's contribution would go up to $251. For and just a little background, we currently have 30 retirees in this program. That can change depending on when people turn 65 and they roll off the program, or new retirees who may be eligible and may wish to participate. But currently we have 30 retirees. Over 90% choose either single coverage or single plus spouse. So while we do have 4 tiers, the vast majority are in those 2 tiers. For a single participant, that city subsidy would go from $200 to $251 based on the current total premium. For a retiree, for that retiree that's in the Retiree Plus Spouse Plan, that would go from $500 to $533. And what the city contribution would be toward that monthly premium. So, that was part of, as a staff sat together and looked at, not only has that flat amount not changed in a number of years, but by proposing a formula, that's something that if 40% is acceptable, the Human Resources Department can prepare that calculation every year once they receive what that total premium will be, the same way that they make a recommendation for the active employees based off of that active employee formula that's in place.
So do we know how many employees are still eligible? Not just gonna do it, but just are eligible to do this? Because certainly not every employee is gonna retire prior to 65.
Or even choose to stay on the plan. We do, as you would recall, certainly several years ago, the accounting standards changed, and we had to hire an actuary to do calculations called other post-employment benefits, OPEB for short. And every 2 years, we're required by accounting standards to have that calculation redone. And that calculation is being done now for this coming year. And certainly the actuary, what the actuary does is receives the information on our active employees as well as their birth dates, and if they have a spouse, their spouse's birth dates, and based on our history makes an assumption of how many persons will elect. So while we do analysis, and that is every other year, it is an assumption that not all of our retirees go out before age 65, and not everyone that goes out before 65 stays on our insurance. They may have other things that they can do. So right now it's 30 retirees. It will go up and down based on the needs of those people when they do choose to retire. And then certainly which tier they select will depend, because it is a small group. It's always a small group. And that's why we presented you a financial impact based on this current group, knowing that it will look somewhat different this time next year, because some of these folks are rolling off and some new people may choose to elect, and they may choose different plans. But we can tell you from our history that over 90% choose single or single plus spouse, and we have been in around the 30 retiree population, give or take a couple.
Plus, we also have the potential for a premium increase also. So,
That's always going to be part
Yeah.
of the calculation. And this, we think, would just give us an ongoing guidance about what we would contribute to folks in these categories.
Alderman Speedy?
My only comment would be, I guess with the 40%, we're never going to run into like an adverse selection where we're offering a higher percentage than they can get at a current employer, where they were going to stay in our plan versus go to another plan. Because I think if you go above that 50% on a single, then yeah, they could say, oh, I'm just going to stay on the City of Franklin's plan versus.
Go work elsewhere. and
Right,
get
so I
our
think the
insurance. Yeah.
40% is probably just, yeah.
It's kind of a balancing act about where to choose, and that's what we looked at. What was a meaningful contribution, but it is different as a retiree. As you know, our active employees, we do 85% on single and 80% on the employee plus or the family categories. And everyone benefited, retirees included, when we added the additional tiers where it could be plus spouse or plus child. That did give a more affordable option for everybody. And so I think this combination just helps us better tailor for everybody with the tiers and then with a known percentage share going forward.
Item 10 and 11. We'll just take both of those together if we could, which is ordinance 2019-14 to create a Title IX, Chapter 11 of the Franklin Municipal Code establishing regulations for operating a mobile food vending business within the city of Franklin, and then the accompanying ordinance amending the City of Franklin Code Appendix A with business, peddlers, solicitors, taxi cabs, pool rooms, licensings, pedicab, do we have any pool rooms? To establish a mobile food vending permit fee. And I think Vernon's going to give the presentation, and I think Vernon would like to go through the presentation completely and then take questions if he could. And then we do have a couple of speakers.
So yeah, we're following up on some discussion we had with you a couple different times previously, but maybe a couple months ago, and one of the specific requests was to gather some additional input from stakeholders and kind of walk through some of the specific proposals and items we had put before you. We've done that work and want to come back to you, and our staff team, and it has been a staff team across multiple groups, have worked on this to provide a more tailored regulation for mobile food vending. We've looked at a lot of different other communities and how they've managed it. We've included input from folks who work in this area and in this business to give us feedback, and I think we've provided you with some good guidance and feedback from those folks to help shape an ordinance. So Vernon's going to take you through that.
Well, thank you, Eric, Mayor, and Alderman, and appreciate you spending and being patient while we spent 12 months trying to get us to where we are today. And our intent is that hopefully this ordinance meets your expectations as best as it can, so we can bring it forward in June for a couple readings and hopefully approval, and we can move on. A couple of things before I get started. I do want to recognize my colleagues that worked diligently and every 2, 3, 4 weeks in meeting, and Lisa and Paige from our Parks Department, Shauna from our Law Department, Chris Andrews from Planning and our Sustainability Department, Molly, Shannon, and Teresa from the Building and Neighborhood Services Department, and Carla and Tabitha from our Revenue Management team. And we really looked at it closely. More importantly, when we started this, we looked at other communities. And what became most evident and recommended from all those communities, and I believe you've heard me say this before, is that you're not going to please everybody. And when you adopt something by ordinance, look at it as a pilot program, and that's what we're recommending. This industry changes, our community changes. We shouldn't hesitate to come back to this after we've had a year or two under our belt. We did get input from stakeholders on multiple occasions, and even yourselves. And I want to reiterate that the input we received is quite different on the spectrum. So with that, I want to take you through just a couple steps, a few minutes at most. First of all, to look at what the city of Brentwood and Williamson County has done as a comparison since they're our neighbors. Then I'll walk through some of the changes from our last work session and meeting with several of the stakeholders. And then we'll talk a little bit about what we're calling a location-specific mobile food permit. So, thank you. So with the city of Brentwood, in about 2017, they adopted an ordinance. They do not allow any fixed locations of mobile. Oh, it's not up there? Oh, I'm sorry. Thank you. Of mobile food vehicles, no overnight stays. We do accommodate that under certain conditions, of which you'll get to. Vending, much like what we're proposing, is allowed in commercial office, retail, service warehouse, their town center. We're allowing that too. They do allow vending for institutional education and assisted care uses, which we do provide for some options, as well as in residential districts. Williamson County, again, doesn't allow any fixed locations, no overnight stays. They allow mobile food vehicles for up to 6 months at very specific zone districts in the county. They issue a temporary use permit and have a minor site plan. They only allow 1 mobile food vehicle per property at any given time. You might have noticed in our ordinance, we're not proposing to regulate how many mobile food vehicles can be on a property in operation at any one time, just overnight, which we'll get to. Both Williamson County and Brentwood, they limit operation. Brentwood from 7 to 9 p.m., Williamson County from 8 a.m. to 8 p.m. So the highlights of what we're proposing in the ordinance before you this evening. Mobile food vehicles will be allowed to operate in office, commercial, industrial, mixed use, and civic institutional zoning districts. We had talked previously about caterers. They will not be impacted by this ordinance in any way, shape, or form, as long as they're serving at private parties and are not making sales directly to the public. Mobile food vehicles, we have a definition of in operation, will be permitted annually for a fee of $100, but will be expected to leave the site when not setting up, in operation, or preparing to leave the site, except for properties that have a valid location-specific mobile food permit. A location-specific mobile vending permit is issued to a property owner and would allow for 1 mobile food vehicle to remain on the property overnight, even when not open for business, indefinitely. There'd be no time restrictions. Location-specific mobile food vending permits are limited to property that would be limited to property that is not located in the floodway or floodplain. And we as a team had a long discussion on why would we not allow mobile food trucks, vehicles in the floodway or floodplain to stay overnight unattended. And I'll let Molly address that since she works closely with Shanna, who's the city's floodplain manager.
It's great. We determined, I believe you all know, that there is a FEMA program called the Community Rating System, which is, City of Franklin is a part of this system. And with that community rating system, we have certain standards that have to be met. And our standards are higher than FEMA's standards. And as a part of that, having higher standards, we get lower insurance. We get a discount of insurance for individuals that have property in the floodplain. As part of this, we are strongly recommending that we do not allow any location-specific food vehicles in the floodplain or floodway, but that we do allow the temporary use of vehicles when they are open for use to be allowed in those locations. We do not want any issues with our rating in the community rating system to be affected by allowing vehicles in the floodplain, and so would hope that you would agree with our recommendation.
Thank you, Molly. I would add to what Molly said, our zoning ordinance and past practices are very restrictive of what can be in the floodplain. To the point where new development is limited to really open civic type of uses. And any structure put in the floodplain needs to be flood-proofed. Thereby, our recommendation comes that knowingly permitting a mobile food vehicle to remain in the floodplain unattended did not seem to be consistent with our past practices of what we allow in the floodplain. So with that, there are some other requirements that you may have pointed out or seen in the draft ordinance. I will leave you with this before we accept any questions. It did take us 12 months to work with this. We've tried to address as best as possible the needs of existing businesses that provided input, your comments, the mobile food vendors, and we know we weren't going to be successful. But one thing became clear as we worked through it, that the challenge became that we were trying to make a permanent use out of something that is temporary. And perhaps that's why communities like Brentwood, Williamson County have decided not to allow overnight stays and just to allow them in operation. Thank you for bearing with us. Thank you to our team. And hopefully we're able to move this on and see how it works. No, I've got
I don't see any questions coming, so I've got two people. We'll give them a couple of minutes each, Mark Mogul and Jake Raines. So y'all can come up and sit down and be part of the group.
Okay.
You'd have to report it, Alderman Martin, if you got a donut.
Donuts in Franklin. Thank you. And I know that there's been a lot of work put in, so I'll say that first of all. Last March of 2018, I made an application and presented to the city my application with the geophysical location of exactly where I was going to be, and that was in the floodplain in the city of Franklin, and that I was awarded a permit for that, which was the itinerant merchant permit at that time. So that has not changed since then, and I've been there for now for 13 months. We found that in just talking about the floodplain specifically, Cincinnati, Springfield, Missouri, St. Louis, New Orleans, Austin, Texas, St. Augustine, Florida, in the last 2 years have all adopted what they call mobile food parks in those cities in floodplains. And they specifically have said that those floodplains, that's the highest and best use for that, because those businesses can move in case of the danger of a flood. So I'm not sure why we're not, and this was back in, when we talked about this last month in April, the regulation looked like we had really made a lot of progress. The draft looked great. And there were several items in the draft that now have been removed. One of the things specifically being that whether it be in a floodplain or not in a floodplain, for a semi-permanent place, semi-permanent, now it's called semi-permanent mobile food vendor, to have utility connects, which would be quick connects, electrical, water and sewage. And those were all things that were in the draft back in April, and there wasn't really any pushback on that from what we had seen. Now that's been completely removed from that from the new proposed regulation. And on private property, I don't see why that would be a restriction that should be placed there, whether it be in the floodplain or not the floodplain. And that's what all these other municipalities are doing, exactly that. They're allowing those businesses to come in for a semi-permanent, because according to FEMA regulations, we have to be highway mobile if we're in a floodplain. And so a mobile food truck or trailer is what I have, which the closest definition that FEMA could come up with was a recreational vehicle. And they're saying the highest and best use for some floodplains is for recreational vehicles because they can be, as long as they are highway ready and licensed, that they can move in case of any kind of disaster. And so certainly I have a lot of money invested in my particular, and I feel a little bit, that's a little bit personal to me because I am the one business that is in the floodplain here in Franklin. I have security cameras that watch. When we had the rain and potential flooding a few months ago, I spent all night watching my cameras, and I could have moved my Airstream in 10 minutes if there had been a danger. I talked to the police when they came, the fast water rescue team. They advised me on what I should do, and I was fully prepared to move. So I have a lot invested in it, so there's certainly not going to leave my business any risk of me leaving it there. So there's no logic to me that why I couldn't be in that particular area. So there's several things that, you know, the utility connections, being in the, and the city and myself went to FEMA. We went to Amy Miller, who's the Tennessee representative for FEMA, and then she took it up to Washington, D.C., and got an opinion, and she said exactly the same thing that I said, is that the use of that type of property for this type of business or for, say, an RV park, and the 180-day issue that we talked about last April is actually not an issue because what they do is once every 180 days, they hook up all the vehicles in an RV park. And they have she cited a couple examples in the United States that do that. And they have a parade around to show that they're all highway ready and licensed, and then they go back and they park back in their same spot. So it's again, we're in a, this is a, it's, you know, it's kind of a fluid situation that this industry is growing tremendously and rapidly, and there's a huge demand for it. If I didn't have a successful business where I'm sitting, I wouldn't be fighting so hard to make sure that we could be here. And we're, in fact, Jake Raines is now my partner. We're doing a second Airstream. We're looking at other locations in Franklin where we would like to be. So I think that this needs more work. And I think that we need to look at it and look at it more globally. When I first started back in March, I was in Williamson County. Williamson County gave me a permit too. And then they came back to me a month later and said, we don't have anything in the code because food trucks and mobile food vending is not even allowed in Williamson County. That was in March of 2018. There was nothing in the code. So in July, they did adopt a code that allowed for what Vernon just showed you. So it's brand new, it's very limited, and I don't see how that really puts us, I mean, Franklin is in the forefront in so many areas, and we're looking at all these other cities that are starting to adapt this as beneficial to the people who live here.
Mr. Ryan?
I'm just reiterate what he said. I'm here for support. So.
Ditto. Alderman Martin.
What would be our ability to grandfather this in, since they've been here 16 months and we've not adopted this yet? If we adopt this ordinance or this agreement, could we not grandfather this particular business?
There's a provision in the new regulation that says that the aldermen have the ability to make an exception, and they may do that.
I think that question was to staff.
Oh, I'm sorry.
Well, thank you, Eric. We had, if you go back in time, we had issued itinerant merchant license to mobile food vendors. Then Mr. Mogul asked us to look into this, so we provided a grace period over the last 12 months that actually expires at the end of June to examine options. So since it wasn't permitted as a use, permanent use, it wouldn't be grandfathered. But because we're going to license them, and that has always been the intent, that we would provide annual licenses to the mobile food vehicles, and then we would issue a permit to property owners that would like a location-specific permit, but they would need to be out of the floodplain. Certainly, the Board of Mayor and Aldermen could say, we don't care where you issue location-specific permits. And that would be fine, too. As staff, given the guidance we received from the Board of Mayor and Aldermen in our zoning ordinance and our management of the floodplain, we didn't think it was a responsible recommendation based on how we oversee what happens in the floodplain to recommend to have, to issue a permit for a mobile food vehicle that's not floodplain, not floodproof, to stay unattended overnight. Granted, Mr. Mogul said he has cameras and watches it, and during some of the storms, some of our police officers, emergency personnel reached out to them, but we're not in this ordinance controlling how many location-specific permits could be issued. So that's why we're not recommending it to be in the floodplain. But you could change that if you want.
Well, I understand, I understand about FEMA, and we've got to protect our standing with them. However, didn't you say you had a permit to do this? You got a permit to have your business there? You didn't?
Well, the city gave me a permit last March of 2018, or last April of 2018. They gave me, well, in order for me to get my itinerant merchant permit in the city of Franklin, I had to give a photo of my business, exactly how it was going to sit, where it was going to sit, and of course the location, exactly where it was. And so I went through the whole process of getting the police background check.
Well, I don't really care what you had to give.
No, ma'am. So what
You've got a permit.
Yes, ma'am.
Yes, if I may. Yes, he received an itinerant permit with the instructions that we have historically provided that they needed to move every day. As you, Alderman Martin, were aware of the person that had the trailer that parked next to the bookstore for about a year or so. They moved. It was Mr. Mogul that prompted us to take a look at allowing it there, and we provided the grace period, which allowed him to stay there. But that permit was issued clearly with the understanding that he needed to move daily.
Go ahead, I'll give you just one quick response.
Thank you.
And
So-
I'll go back to the board.
When I was given my permit, I asked specifically if I had to move at night, and I was told that I did not. When the city came back a month later, they asked me, they said I was in violation of the code. I asked if they could show me where in the code it stated that. They came back 3 days later and said, we had a meeting, and it was our interpretation of the code that you should move at night. It does not say, it did not say, it still does not say today that we have to move on a nightly basis. I said I was ready to comply. Please show me where it says in the code that I need to move nightly. It does not state that. So that's why we're sitting here today.
Alderman Bransford.
Thank you. Molly, just explain again about our federal FEMA relationship, because personally, I just think that would be sort of the ideal place to put some of these trucks. And since they are mobile and sound like you all went to Washington or you communicated in Washington, and there was some kind of explanation that was okay for these vehicles to be in that floodplain, is that true?
FEMA has certain standards for recreational vehicles to be allowed in floodplain and even in floodway. Our standards are higher than the minimum FEMA standards. And since we have property in the floodplain and floodway, and we are part of the community rating system, which allows for that insurance deduction, as staff, we just feel like, yes, that's an appropriate use, but they should come and go every day and not stay at that one location.
Yeah. Thank you.
Alderman McClendon and then Alderman Speed.
Well, my question is, were we to make the location-specific mobile food vending permit dependent upon the permittee being highway ready, would we suffer any adverse consequence in the eyes of FEMA?
I will not try to speak for FEMA.
Good point.
I can speak for staff and tell you that FEMA does have certain criteria to allow a recreational vehicle to remain in the floodplain. And if that is what the board decides that we want to allow in our standard, then, we will enforce that allowance.
Okay, well, with all due respect to staff's position on this, it sounds a little bit like staff telling me that I should carry an umbrella every day, including today. We're not talking about tornadoes, we're talking about floods. And flood events are generally knowable in advance. Or certainly something that can be reacted to within reasonable speed. I understand we're trying to protect, well, we're trying to protect private property. The person with the greatest incentive to do that is, of course, the permittee. My inclination is to say that any of these mobile food vendors, whether it's a location-specific or a vehicle, be and remain highway ready, and that in the case of a location-specific mobile food vending permit, that the vendor be able to evacuate the premises promptly with all of their accoutrements, decks, umbrellas, chairs, all of the above. Because I do think we have a responsibility to not just have the trailer removed, but to have all the flotsam and jetsam that could potentially be as well. So in the event, I don't see, I've seen, I don't know, a dozen, I'm just working from memory, a dozen, maybe 24 events where, for example, the lot where Mr. Mogul's business is got covered up, I don't know, a couple dozen times? Maybe. I don't know. Maybe it's a little more. But I never went to bed and woke up and went, oh my God. We knew. You knew it was coming. And there's a certain set of vectors that have to come together for it to happen, and they're generally knowable in advance. And I think prohibiting someone from having a permit to vend there 364 days out of the year because of the one day of the year that it might not be amenable to the use of it is, I get it, and I appreciate staff's recommendation. I think I'm going to respectfully reject that and say that the location-specific permits should be issued only to vendors who can demonstrate highway readiness and who can promptly evacuate upon notice. And I would even reserve the authority for the staff to give that notice and say, whether you think it's coming or not, we're telling you to get out. That way we protect, I think we're protecting we're balancing the private property interest against the government interest in these permits.
Alderman Speedy, with your permission, Mr. Girth wants to make a response to Mr. Alderman McClendon.
Because Alderman McClendon brought up something. In this ordinance, we are very specific that whether it was a mobile food vehicle in operation or it was one that was staged at a location-specific site, that every night tables, chairs, and signage need to be stored indoors, and that no decks or steps could be built. So as you consider perhaps allowing more flexibility, that you keep that in mind, that change would need to be reflected in the ordinance. And I'll also go back, because this is all good conversation, but as you can see, the challenge our team had over the last 12 years in balancing the different conversations, thank you, is that the challenge is trying to make a temporary use, a mobile use, permanent. So you can do that, but it comes with certain challenges.
Alderman Speedy.
Similar to what Alderman Bransford mentioned, this does seem like obviously the best use of this land. We can't have any permanent structures there. We want something mobile, and piggybacking on Alderman McClendon's claim, if we can prove that this is highway ready and they can get out of there quickly, I would tend to agree with Alderman McClendon that I don't think the city wants to create a situation where we're liable for that if they choose to stay there, but I think obviously the owners have a very vested interest in a significant investment, and that if he didn't move it in a flood situation, then we're not liable, obviously. And I guess I would be more curious to see a little more what Cincinnati has done. I would think if we could prove to FEMA that every vending business was mobile and be able to leave within whatever 15 minutes, I'd just be surprised that would affect a FEMA rating.
Alderman Barnhill.
So if this business was not in the floodway or the floodplain, it wouldn't be affected?
Correct.
Okay. And the last comment, I think what you've done is to protect the city's interest as much as possible as far as insurance ratings are concerned. And when you do that, then you protect the interest of 80,000 people, okay? So I'm not, I don't mind, I'm not necessarily minding that you have move it out in 10 minutes, okay? First off, I don't think you can move it out in 10 minutes because I don't think you can get over and get hooked up. I've hooked up trailers in the past myself, and you don't hook them up in 10 minutes, okay? But that's neither here nor there. But what I compliment you on is the desire to protect the city, the floodway, the interest. Whether or not this is a good location for whatever you're doing, that's fine. I don't have a problem with that. If it's going to sit there for a year without ever being moved, it basically isn't mobile. It's there. It's a permanent business. So you may want to look at that a little bit, but keep working on what you've got, okay?
Okay, we need to move on to item 12, which is consideration of amendment number 1 in the amount of $40,000 professional services agreement for architectural services, City of Franklin Contract 2017-0256 with the Renaissance Group for additional engineering service required for the development of the site for the City of Franklin Fire Station 7 located at 900 Runacini Way. Is that in Italy?
It's in South Franklin.
South Franklin.
Not the south
No
of Italy,
wonder.
no.
It's not a resort area.
So basically, we want to get an amendment for some additional design services. We've got some need to relocate some power lines and infrastructure there to help that site function better, and having this additional amendment to provide some additional design support will help us do that. So that's pretty straightforward in terms of what we're asking for.
It's additional engineering. When we got to the site, I don't know if you've noticed Mount Franklin that was developed over there, but we ended up moving Bruciani Way down a little bit, so that required some additional engineering. Instead of haul off of thousands of loads of material, we were able to come up with keeping it on site, so that had to be engineered as well. So it's some other cost for our engineer that's working their contract through Renaissance Group. So that's the reason for our need.
Okay, we'll resume promptly at 7.
Thank you.
Thanks.